So I'm Pippa Wilding. I'm Head of Nursing and Quality at St Nicholas Hospice. I've been here just for 14 months, but I've worked here previously. So my new role is as Head of Nursing and Quality, so I'm really focusing on the quality elements to ensure patients have a safe, effective journey with us. It's the great bit is about hopefully making a difference in people's lives, but also from my perspective is supporting staff and developing staff to do the best they can for patients and families. So whilst I might not be directly involved in patient care, it's very much about enabling and equipping colleagues to do so. So when I joined the hospice again, say 14 months ago, radar had been embedded for 2 years. So previously we were very much doing things separately. So incident reporting was done via paper, policies was held on our own hospice drive. So we've integrated everything, and that's certainly been a fantastic benefit. We've got all policies, all contracts, all incidents, all audits. We're also including now our CQC quality statements and feedback from patients and families. So it's all integrated into one place, which just makes life much more effective, and we can pull regular reports. I think from a manager's perspective, we can very quickly see themes that are emerging, and that then enables us to make any changes. But also, it's in terms of staff learning and development, we can show them the themes as well, which I think is hugely important for staff understanding why we're implementing change, because we can show them the trends that are emerging, which is really helpful. I think it's that understanding, isn't it, rather than just implementing change, it's knowing the rationale as to why you're implementing the change. And I think that's always helpful in people's practice, not, if they're just implementing something for the sake of it. There is a valid reason why the change is being made. I would hope that they're having a better quality experience and it's more seamless service. In terms of direct feedback from patients around changes for radar, obviously you would not expect patients and families to notice. But in the feedback we get from the majority of patients and families, they are impressed with the high quality care that's given. So we have a weekly managers quality huddle on a Monday, and then one of the things we are looking at is what incidents have occurred over the past week. Are there any themes that have emerged from that? What are the priorities of those incidents? Are there any immediate changes we need to look at? Are there any training needs coming from it? It's also really helpful to look at what policies and guidelines are coming up for review. So it's that, in terms of making us more time efficient, it's looking at those themes that are top priority from a time perspective. Internally, we can show new staff how systems work in terms of we're just implementing PSURF. So we've got all the PSURF documents on radar now, so that's now reported straight into NHS England. It's making our closer collaborative working with our ICB colleagues, particularly to deliver on the end-of-life care strategy for the ICB. And we've recently done a joint after-action review, which was really good collaborative working by using our data, and our partners are also starting to move across to radar as well. So that's making it a more seamless service and hopefully better quality outcomes for patients and families. I think it will. It's interesting. My son works at Guy's and St Thomas's, and they've recently moved across as well. So that he's doing that obviously at a very much larger scale than we are. It seems to be the trend that most healthcare providers are moving across. So I think the fact that if we are moving to similar systems, that also makes it easier for joined up working. So with West Suffolk, hopefully if there was an incident, that we can just then tag it to them and vice versa as well, which will make better, closer working. I think it's in terms of making us more time efficient and therefore more effective. Also, I think we've had a lot of new staff come on board. We've increased our bed capacity this year. Is for inductions of new staff, it's one central point. You go to Radar for policies, for incident reporting. If you need to do an audit, if we're uploading some patient feedback for CQC, for the quality statements, it's all going into one place. So hopefully that's making it easier for staff, and I'm all for that. But also, I think for our perspective as managers, it's looking at the trends and the reporting and the dashboard, which we're starting to use a lot more of now. Again, for me, it's looking at trends. For example, for falls, what time of day are they happening? Are there any themes there? You can really drill down and get that extra data, whereas previously you'd be having someone doing a paper sift, going through all reporting to find out what time it was. There was one example of patient falls was happening during MDT. When that was taking place, we thought, actually, do we need to have another member of staff available to support the ward while some of our colleagues are at the MDT meeting? So it's really useful for that. It looks at not only quality but patient safety as well. So we meet with senior clinical managers each Monday. So we are reviewing the previous week in terms of incidents, out of hours on call that the managers had, any safeguarding issues. So therefore we have got Radar up on the screen as part of that quality huddle again. So we've got that overview of what's happened in the week, and then therefore we will plan the following week accordingly. Yes, because we can just pull a weekly report of all the incidents. So again, it's for me, I'm all about efficiency and effectiveness, which is, that's what Radar's done for us rather than having paper. It gives us we can have a deeper dive. So look at more information more quickly. And therefore, if we are planning any changes and implementing changes, we can go to that next level of detail. And again, I think it's if you are implementing change for staff, if they know why, it's more likely to happen. You're more likely to get them on board. Therefore, I always think with additional information, you can then share that with our colleagues. We each get, I look forward to my Sunday afternoon Radar emails when I know which actions that I need to complete, but also people I line manage as well. So you get that overarching view on a Sunday, which I then take to Quality Huddle on a Monday. But it just gives us that overview of what we need to be focusing on for the following week. And the fact that you get regular updates. I had one this morning about an incident, so I can immediately log in. In fact, I do it on my phone, so I can log in and see what it's about. Is there anything that's urgent that needs addressing? So I like the fact it's mobile. Like I say, I can literally be walking around with looking at action plans on my phone. So again, I think you can just do things more quickly, more efficiently, and implement change if you need to straight away. So we are, as St Nicholas Hospice, we're not just this building here where we have inpatients and clinics. We are also very much having a large presence in our community, and we've got about 220 patients on our caseloads and families in the community right now of West Suffolk, which we've got a population of about 275,000. So we're very well established in the community, not just here on site. And it's about supporting and reaching out to more patients and families. We are just about to undertake an out of hours pilot of doing a community overnight service, and that's to support and enable more people to remain wherever they call home rather than being conveyed to an acute hospital at end of life, which is probably not what they wish to happen and not the most appropriate place to be either for them. So we're really developing those projects, and it's based on the end-of-life care strategy and what's important to people. So it's very much listening to what our community are telling us as well. We're very much say to patients and families when they're coming in, it enables the family member to be a family member, to be the husband, the wife, the partner, the daughter, rather than the carer. And it's often just giving them that permission that's really important. But also when somebody has died in our care, we haven't got the same pressure as our acute colleagues of, there's somebody coming up from ED in the next 20 minutes. We will support that family for as long as is need be. And that's really important because that initial bereavement support will affect their bereavement journey. So really positive support at the time someone's died. And somebody might, wish to stay here for 6 to 12 hours. That's not uncommon sometimes. And we're able to do that. And I think that's where we are very fortunate. But it does have a huge positive impact on their bereavement journey. I think, at the moment, we're still building on our capacity to use it more effectively. I think if with anything, actually we can do more. It can do more to support us. So I think there's always that ongoing learning, which is fantastic. As a manager, I'm using it regularly, so I'm much more familiar with it. So I think it's people who are using it less often. But I think certainly for incident reporting, which is what a lot of the patient-facing clinicians are using it, less frequently. But at least with the domains, it is quite prescriptive. You can't move on till you've completed the previous domain. So they do work through it. Yes, because and the good thing about having all the policies on radar as well, it's one go-to place, which I think is extremely helpful. And we're trying to now link our electronic patient record system through to radar with policies as well. So I'm all for making it one seamless link. Therefore, I think it will make it much more straightforward for staff, and they just know, go to radar and they can implement and upload that instant, and then we get notification straight away. So it's just works much more effectively. I think the clinical directorate uses it more. We've got more policies and guidelines, and we probably implement more incidents reporting on there as well, because we do have a very low threshold for reporting incidents. So again, that's a positive from the staff, that they feel comfortable to use it and report. So I would say that clinical directorate uses it much more efficiently and effectively. But it is a central, repository for all the organisational policies, all contracts as well. And it's just reminding people that when we get a new contract, put it on radar, so it's in one place. Yeah, I've got education sits under my portfolio, and I've got contracts with the local universities for student placement. So again, all those contracts go straight onto radar. So I know they're in one central place, and then you obviously get an alert when it's coming up for renewal. So makes my life more efficient and effective, hopefully. My sense is would be helpful for everyone to go across on the same platform for continuity and consistency. In terms of, it's obviously an initial piece of work to undertake to upload all the information to begin with, but then once it's all there, it's very easy and it's very straightforward to upload more further documents. So I would be recommending it, having used it. I like the fact it's mobile. I've got it on my phone because I can access it wherever I am. Like when I was walking the dogs this morning, saw an incident had come in overnight. I just find that very useful, and I can be up to date continuously. We've got an outreach centre in Haverhill in South Suffolk. Obviously a lot of people are working in a hybrid way as well. It just think in this world we should be more mobile. Literally having mobile data is very useful, but also when we are doing on call as well out of hours, it's very useful to have it. No, it is very useful. It's, when we've had before, when we had paper incidents, occasionally they would go missing. But in terms of doing that auditing, it's so much easier. And I'm all for that. And as I said, I do like IT gadgets, so.